Dear students, we'll discuss a material which is hemostatic, especially used in surgery when there is bone is involved in the surgical field, like in orthopedic surgeries, in general surgery, amputation. Very commonly, amputations are done more commonly by general surgeon than orthopedicians. And neurosurgeons, because they have to cut the skull to approach anytime, always, so they use very commonly. Orthopedician they use very commonly. So wherever bone is involved, to prevent the oozing, to stop the seal the oozing from the bone marrow, this is used. See that bone wax. So what it contains, this is how exactly it looks like. See that, and what is the content? It otherwise called Horsley's bone wax. Contains beeswax in almond oil or isopropyl palmitate as a preservative. Beeswax with the almond oil, or in many this one isopropyl palmitate as a content. So it is physical and mechanical hemostatic agent. Remember, it is used in amputation stump, already told, bone, skull surgeries, dental surgeries. Dentists commonly use this one because very essential for them, because for all those dental and other reconstructive procedures they do now. So they use it very commonly. Mandibular surgeries, it's low cost, easy to apply, inert, malleable, seals the marrow easily to control the bleeding. They mainly used to control the bleeding. That is important thing. Otherwise, it will keep on oozing. It will be distressing, difficult to control otherwise by any method, even cautery, difficult to control oozing from the bone marrow. It's a very good material for that. And problems are granuloma formation, allergy, infection, and migration. So the problems, but not very common. So not even though which are so commonly, these problems are rarely seen, but it is the known complications of the bone wax. So answer the MCQ. The most common blood transfusion reaction is A. Hemolytic reaction, B. Infection transmissions, C. Febrile non-hemolytic transfusion reaction, D. Electrolyte imbalance. Put the correct answer in the comment box. So we'll put the right answer later, please. So answer the another MCQ. Unit of blood rise at the hemoglobin concentration by A. 0.5 gram percent, B. 1 gram percent, C. 1.5 gram percent, D. 2 gram percent. Again, student, please put the right answer in the comment box. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigations. Of course, treatment is not a topic will be covered in a clinical method examination. Remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. Which covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's Atlas of Tissue Approach, small book atlas, 100 pages. how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My DigiNour lectures through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.